The question comes up, are you doing everything you need to be doing, according to the FDA, when it comes to handling product complaints? What is a product complaint anyway? Are companies perhaps over-reporting or perhaps under-reporting complaints to the FDA? Well, our next guest is an expert on FDA complaint handling. Grant Ramaley is Director of Regulatory Affairs for Aseptico Incorporated, co-chairman of the Regulatory Affairs and Standards Committee for the Dental Trade Alliance, convener for the ISO 13485 Working Group at the International Accreditation Forum, and technical committee advisor to the Asian Harmonization Working Party. In other words, he's a pretty smart guy when it comes to working with the FDA. Good morning, Grant.
Good morning, Dirk.
All right, well, in your article, Passing FDA Quality System Inspection, you write, quote, the FDA has said that ISO 13485 covers about 90% or more of its quality system requirements. How nice. But what about the other 10%? Many manufacturers are surprised when an FDA investigator asks questions about other parts in the federal regulation that don't align with ISO 13485. So my question is, can you give us a couple of examples of that missing 10% in 13485 that might catch companies off guard when the FDA comes around?
Yeah, Dirk, and I think one of the things that catches most people off guard that have an ISO certification is there's much more of a quality focus, whereas when an FDA inspection occurs, the investigators are much more focused on public health. They go right for a complaint file. And of course, there's feedback systems in 13485, and they're much more aligned now than ever before with the FDA requirements. But there's really a cultural shift in the audit with an FDA inspection. I mean, many of the FDA investigators don't have a 13485 background. They have their training on the quality system on Part 820, which fortunately is 90% aligned with it. So if you have a 13485 system, you're in pretty good shape. But they spend a lot of time looking at the complaint file. They want to see that the procedures reflect the FDA's focus on public health protection. They're going to be looking a lot more at those parts of the regulation that address medical device reporting, corrections and removals of product to prevent a public health risk. And so Part 803 and Part 806 are a couple of the outlier parts of the federal regulation that get a lot of attention during an FDA inspection. And it's really important for the company to demonstrate to the FDA that there's a culture that they can rely on there that has a common interest in protecting the public health, not just have a quality system.
So Grant, when it comes to the FDA and complaints, quote unquote, there seems to be some confusion. Not every complaint is a complaint in terms of what the FDA is looking for. So can you explain what the FDA really is looking for?
Well, certainly, and it really comes down to this. I mean, if a company is collecting thousands of reports of a device not working because they have a service department that repairs them, they can probably figure that most of those are going to be not complaints. They're going to be something that just needs a repair of that one device. The customer may be pounding his fist on the table and saying, I want a warranty repair. This thing, shouldn't have gone out. But in fact, the device is 10 years past its warranty. So there are complaints like that the complaint unit that I refer to in the article is the designated group within a medical device company that would handle evaluation of those types of incidences or complaints. They're going to take those in and they're going to look, is this guy really have a complaint against the product in general? Or is this really just a routine repair and he's trying to get a free warranty repair? And so there is some gray area in there. I think a lot of companies tend to want to take some precautions, and they want to throw all those repairs into the category of being a complaint. But the FDA really isn't looking at routine repairs as complaints, and that's made even more clear in a document that they have available for people to look at called the preamble, where they talk about the repairs and those sorts of complaints that are made against individual products. Those will be collected, and they'll feed back into the corrective and preventive action system through trending, and improvements will be made that way.
Hey, Grant, I mean, if I can just jump in then, I mean, how does a company make that distinction? I mean, you said there's a gray area, so I mean, how does a company, in their own minds, understand whether this is something they should report or not?
Well, to put it simply, if they're attacking the model number, so if they're making a suggestion that says, these devices you have on the market don't work because mine didn't this way. If you get, if they're not working the way that they're supposed to, one of the statements is that the device should perform as intended. If you look at the definition in 820.198-3, it's in the article. It's alleging a deficiency with the product. And the company is also going to be aware of certain things that just shouldn't happen. I mean, we design devices to work, within their warranty period. So if they fail, upon arrival, obviously that would be something that would be a complaint. So there's a couple of different ways that you can approach looking at a complaint. One is the customer is attacking the product model number, and the other is that they're saying, hey, I just opened this thing up and it didn't work. I've only had it a week and it broke down and I haven't done anything wrong with it. Well, the manufacturer is going to obviously look at that as there being something wrong with the device. It may be just that unit. And they'll have to look at that during the investigation process and find out whether it was just a one-off mistake or if there was a design flaw that could have affected,
Yeah, that was going to be my next question is even if the complaint is about a particular device, I suppose the company itself, if they're tracking all their complaints, they might say, wow, we continue to get complaints on this particular part. Maybe it isn't a one-off, maybe there is, like you said, a design problem. And in that case, would they have to report that to the FDA?
Well, reporting is a whole nother section of the regulation, and it has to do with the severity of the risk to public health. Complaints come in and they're evaluated for reportability. So you want to find out right away, yes, it didn't work right out of the box, but was the kind of failure going to create a public health risk, or is it something that we're going to be looking at from the standpoint of, we've got a quality problem? You don't need to report quality problems that are minor issues with the product. You need to work toward fixing them. It doesn't mean that a device with a minor defect in it, from a standpoint of, a clipped wire doesn't allow a battery to work very well. Well, on a defibrillator, of course, that would be a reportable incident because you're trying to save lives every time you use a defibrillator. So you have to look at the device, you have to look at the consequences of the failure that's being reported to you by the customer and put it in the context of how severe it is before you can determine whether you're going to report it.
Okay. And I'm going to have to cut you off there, Grant, but hopefully this was a good teaser for those of you who are involved in FDA-regulated industries. If complaint handling is a question for you and you're wondering, I want to hear more about what Grant has to say about how I determine, what types of complaints and how they should be reported to the FDA and when they have to be reported. Is it 5 days? Is it 30 days? I'm so confused. Then you want to watch the webinar, Understanding the FDA's Inspection of Parts 820, 803, and 806 as they relate to handling complaints. That webinar, Grant will be the expert on that webinar. That will be Tuesday, May 24th. That's next Tuesday at 2 p.m. Eastern, 11 a.m. Pacific. And again, if you're involved in an FDA-regulated industry, you're going to want to watch this webinar and find out how to handle complaints. If you are interested, if you click on the link to Grant's article underneath the player page there, that'll take you out to his article. That's very good reading. There's some really good information in there. And in that article, there's also a link out to the registration page. So be sure to click that. If you're an FDA-regulated industry, this is a webinar for you.
Yep.
Grant, thanks for joining us this morning. Appreciate you taking the time out of your busy schedule.
All right. Well, thank you for having me.
Hey, no problem. And we'll see you next Tuesday.
See you on the webinar next Tuesday.
Thanks, Grant.
Thanks, Grant.